in May. My name is Ling Hwang. I work with 24-hour home care. So we are a caregiving agency, and we coordinate caregiving services for Medi-Cal families and members. So this is only for people that have Medi-Cal. And so I'm here to talk about personal care and homemaker and respite services under a new state program called CalAIM. This is our team. We want to introduce ourselves here and give you our contact information. And I will send this over to Melissa as well, so she will have this and share with you all. I have my phone number there and also our emails, and you can contact us for additional clarification or if you want to check eligibility for any particular person. So my goal today is to educate all of you about the new state resource that's available for managed Medi-Cal people to access personal care and homemaker or respite services. So those are your non-medical assistants called ADLs, or assistants with daily living. So CalAIM. So this is a new state program, and it was designed to advance Medi-Cal, because Medi-Cal has some gaps there. Sometimes it's not always easy to access. So CalAIM was designed by our state legislators. Governor Newsom signed this legislation 6 years ago to improve on Medi-Cal. So some of the things there are implementing a whole person care approach and address various social drivers of health that are, making people access health, for example, and making people have a better life trajectory, improving the outcome, the quality outcome, and also reducing health disparities where people from different ethnic groups are not getting equal access to health, and creating a very consistent and efficient Medi-Cal system. So obviously our state governor and legislation know that it's not always perfect. So we need to make some changes to better Medi-Cal. So what this looks like is $2.8 billion of investment of taxpayers' money to improve on this. So on this dial here, you'll see several, like 9 different things that CalAIM is designed to address. And we are at that big red arrow called community supports. So our services are falling under community supports. But you see there's other things like dental and supports for justice with adults and youth and various different things. But we're only doing community supports, and that's what I'm here to talk about today. And that is, under community supports, we are doing the respite services and personal care and homemaker. So those are the caregiving services. And those are the non-medical ADLs, such as helping someone with their meals, with their medication, even helping them around the house with different things, and also just supervision, especially for children. And respite, is for the break for the natural caregiver, also providing these services. So we are 24-hour home care. Like I said, we are an agency that provides caregiving services, and we've been doing this since 2008. And Melissa knows as well that part of our business is also working with the regional centers to assist Medi-Cal families get access to services through the regional centers. But we've also been helping a lot of seniors get care, but those were private pay. That means they would pay out of pocket for that. But now we don't do private pay anymore. We only do caregiving services that's funded by the state. So this is zero cost, no out of pocket, no share of costs. So we are in all the counties in California doing this, and we are partners with 23 Medi-Cal plans. So a Medi-Cal plan is a IEHP or Molina, LA Care, HealthNet, Cal Optima, etc. Depending on which county you live in, that's the Medi-Cal plan that is associated with for you. So in the Inland Empire, it would be IEHP and Molina. And we also call them MCOs. So MCOs is Managed Care Organization. And these are some of our partners. We also work with the VA, and also many hospital systems to coordinate caregiving services that's completely funded. So I want to take you through a case study. This is Sarah, and this is one of our clients, actually. She's 11 years old, and she has spina bifida. And her mom is her natural caregiver, but her mom broke her ankle and needs some medical attention. So mom is going to need 3 weeks of rehab and rest, but Sarah needs constant supervision while her mom is recuperating. So what is the goal here for the family? Is to keep Sarah at home with daily assistance and care, and support mom's ability to follow post-surgery care plan so that she can recover, and also get start of care as a replacement caregiver for mom to be there for Sarah. So some of the challenges are that the dad is there, but he works full time. So if he were to take off work to care for Sarah, he might jeopardize his employment. Maybe he won't get paid. And we also want to find a compatible person who is familiar with Sarah's needs and she's comfortable with to be the caregiver while her mom is out, because that could be kind of traumatic for Sarah. And the family does not have any resources to pay for a caregiver. So these are some of the challenges that Sarah's family is facing with the situation. So the potential scenario is dad takes off time, but that could potentially suffer. He could suffer from loss of income. So we'll go back to Sarah, but let me just present our services. So respite, that is giving a break to the primary caregiver. So in this situation, it would be Sarah's mom that we want to give a break to. And the break is giving to natural caregivers on an intermittent or temporary basis. So it's not going to be forever. It's not long-term. It's short-term. And these are your non-medical assistants as needed. And CalAIM is authorizing 336 hours annually, depending on the need of the family. So up to 336. So if the family doesn't have a lot of needs, then it might be just 40 hours. But some situations, they might have a need ongoing, and the maximum would be 336. And that can be combined with IHSS hours as well, but it cannot exceed 24 hours a day if they have IHSS hours. So who's eligible? So like I mentioned, this is for Medi-Cal members, and they have to be managed by a plan. So IEHP or Molina here in the Inland Empire. Now they could be with IHSS or they're not with IHSS, and either way, that is fine. And this is respite. It could be for a professional caregiver, such as the IHSS caregiver or someone that they have hired in the past, or it could be someone that they select that's already a caregiver, like a family member. So let's go back to Sarah. So we know her situation. We know her mom is out of commission. She needs to take care of herself. And so the intervention here for this family is the MCO. MCO is a managed care organization, such as IEHP. We submit a referral to them, telling them about Sarah's situation. We do a virtual assessment for the family. And IEHP, for example, the MCO will authorize 40 hours per week for 5 weeks, and a total of 200 hours to assist Sarah while her mom is unable to take care of her. So 24-hour home care works with the family and identifies Sarah's aunt to be the caregiver. So we hire the aunt, and we actually pay her. So she completes onboarding and orientation to become a 24-hour employee. And so now she is covering for her sister, taking care of Sarah, who is familiar with her, is comfortable with her aunt, and they have ongoing care. So, and the father is able to continue work, to earn income, and the mother is able to focus on her own recovery with peace of mind that Sarah is taken care of. So some examples of respite relief. A parent is needing time off for medical treatment, such as Sarah's mom. A substitute caregiver is selected by the family and employed by 24-hour home care. So in this situation with Sarah, the total funded hours were 200 hours. So let's say with the same family, later in the year, the parents need to attend a funeral out of state. Now they can't leave Sarah alone So this time again, a substitute caregiver is selected by the family and again employed by 24-hour home care for 1 week. And the total funded hours for that 1 week is 132 hours. So 200 and 132 is 332 hours for that year that this family has been authorized for. And the third situation is that the parents are at risk of burnt out. So they have exceeded what is expected of them, and they, mom doesn't ever get a break. She's at risk of burnt out. Now, if mom is at risk of burnt out and she's not able to do that anymore, then that is also impacts Sarah. So CalAIM wants to make sure that these caregivers are getting a break. So in this situation with 332 hours, we could divide that into 52 weeks, and that family could get a little bit more than 6 hours per week. So maybe 6 hours a week, mom could get a break. Maybe she just wants to go get her hair done, or maybe she has physical therapy, or just, take a break for a walk or something. So this is how respite is provided under CalAIM. So for personal care and homemaker, we separated this, but the service is the same. It is, again, your non-medical assistance, like personal care, meal prep, etc. But with personal care and homemaker, there are some situations where they need to have some interaction with IHSS. So the program is designed to be a bridge while they're waiting for IHSS decision on an application or on a reassessment of more hours. Or it's also designed to supplement IHSS. So to add additional hours and then what they're getting from IHSS. So it's not a replacement to IHSS. And again, it can coexist with IHSS, but it cannot exceed 24 hours a day. And the plans will approve it if it's cost efficient. Now, the plans have been very generous in approving unauthorizing hours, the plans such as IEHP and Molina, because in the future, they need to show health equity. Because right now, different ethnic groups are not getting equal access to care. So they're suffering. So we need to show more equity, and the plans are very motivated to authorize care, especially for ethnic demographics. And who is eligible for this? So I mentioned that they had to engage with IHSS. So they're waiting for an IHSS decision, either for initial or a reassessment decision. Or perhaps they have maxed out on IHSS hours. So perhaps your family is getting 283 hours. That is a max that IHSS can give a family. So in those situations, that's about 9.3 hours a day in a week. CalAIM can potentially add more hours to the 9.3. And in some situations, people are not eligible for IHSS. For example, if they don't have a long-term disability, this plan can also provide care for 60 days to avoid that person going to a skilled nursing facility. So in this situation, it's probably for elderly people, but you may have family members too that are on Medi-Cal that are seniors that could benefit from this. So we just want to make sure that you have this resource for your own family, not just for children, but for family members, people that go to your church or neighbors, etc. So how we are staffing this is a model called agency with choice. Some people refer to it as family selected workers. So we're empowering the family to select their own trusted caregivers. This way, they're familiar with the family, they have a cultural competency, they have a language competency, and they can negotiate their schedules on their own. So let's say Sarah's aunt is the caregiver, and she's like, hey, I can do Tuesday, Thursday, Friday, but the other days I have to go to work. They can negotiate that on their own. And then mom can say, okay, the other days I can hire my neighbor. So we can hire multiple people, and they negotiate their own schedule. They have that freedom, and they're empowered to do that. So the agency with choice model, we find that it's reliable and consistent care. We don't send someone to the house because that would be a stranger. We used to do that, but there were a lot of issues with that. For right now, after COVID, it's been really difficult for us to recruit caregivers. And there was, a challenge of providing consistent care. But when a family selects somebody that they know, it's more reliable and consistent, and especially if they're getting compensated with an income. So there's no hourly minimum with this. Like they could have the neighbor just do 1 hour and then aunt could do 9 hours, right? So it's up to them how they want to schedule it. Again, the language problem is not an issue. And I mentioned that you can have multiple caregivers of their choice. So nationwide for Medicaid patients who in California, they're called Medi-Cal members, 80% of caregiving is staffed through this model called AWC, or agency with choice. Choice meaning that they choose their own caregiver. So once they choose their own caregiver, like Sarah's mom said, hey, my sister is going to take care of Sarah for me. She has to become a employee of 24-hour home care. So we sent her an application for employment, and we do a background check, and it's all paid for by 24-hour home care. So with IHSS, they also have to do a background check, but the Medi-Cal member has to pay that fee. And it could be, I think, $65 to $95, depending on where they live. But the background check, we pay for it. So there's no out-of-pocket at all with this program. And so once they clear that background check, which is mandated by the state of California for all caregivers, they must clear a background check and they must clear a criminal records. Then we hire Sarah's sister, for example. And then we also have a training that they can do virtually. But unfortunately, that training is only in English. But they could do it anytime, and they could have someone help them while they're training at their own time. It's virtual, it's on their computer, and they're going to get paid for that time they're training. And then they complete the employment document. It's a W-2 form, and we start mailing them checks. And we have to tell Uncle Sam, we have to tell the federal government who we're paying, and we have to take taxes out, right? So the caregiver, whoever they choose, has to be legal residents, and they have to be over 18. So this is how you can refer yourself. You can go to that yellow box there, which is a link to a form that is going to ask you the questions in the blue box. So, well, number one, number two is your name, your organization. So that would be like Melissa with Autism, Inland Empire. But the member's name, number four, that would be your name or your child's name. And the DOB is the date of birth, the gender, primary language, etc. And number eight is the health plan. So it would be IEHP or Molina. And number nine, the CIN number, that is their Medi-Cal ID number. So if it's for your child, they have a Medi-Cal ID number, and that's CIN number. And that always starts with a number 9. Okay, so, and number 10 is the phone number. 11, are they in the hospital? If not, just put no. Member aware of this referral would be yes, because you're probably referring your child. And then let us know what's the best time to contact you, because we do a virtual assessment by phone. We don't have to come to the house. We ask a bunch of questions, and then we put it into like the system, and it'll recommend like a number of hours that they're recommending. If you have email address, that would be the best thing for us, because we don't have to mail you the application packet and other things. It could be done a lot faster. Member's diagnosis for your child, whatever the diagnosis is, like Sarah's was spina bifida. And why does the member need help? And number 21 is IHSS status. So if you're not engaged with IHSS and you're just looking for respite care, then there's no IHSS requirement there. So you just put no IHSS and so forth. So this if you gather all this information, it takes you about 3.5 minutes. And this form is also HIPAA compliant, which means that it's privacy compliant. So the process of getting this service in place takes about 2 to 3 weeks. Once we get a referral in from that type form, our team will reach out to that member or the point of contact, POC. So that's usually a parent. And we will do that assessment, and that will happen within 1 or 2 days. And then we gather that information, we send that into IEHP. But if we can't get in touch with a person, that just causes delay. So, we just encourage you to pick up the phone and because it comes from a toll-free number. And once we do that assessment, we'll send it into the plan. So IEHP or Molina, and they have 5 days to let us know what they're going to authorize. So with IEHP in the Inland Empire, they've been really, really on it, and they've been authorizing things even less than 5 days. So once we get that authorization, let's say for Sarah, we're authorizing 40 hours. So then we call back the point of contact, the parent, and say, hey, who's going to be your caregiver that's going to take care of Sarah while you're out? Then we start the onboarding process for Sarah's aunt, the background check and the virtual training and all that stuff. So that will take about 2 to 3 weeks. So that's the whole presentation. And we also ask that you connect us if you know anyone else in your community or your neighbor or whoever that could use this resource. Let them get in touch with me, and I'm happy to explain this to them. So is there any questions in the chat?
Hey, Lynn, yes, there are a few questions.
Okay.
The first question is, does this mean regional will no longer fund respite? Will it be Medi-Cal?
So this is the answer is no. Like, we can't coexist with the regional center, but it's not a hard no. So there are some exceptions, some gray areas, because CalAIM is a new program. It is about 2 years old, and with IEHP, our relationship with them is only about a year. So there are some situations where they can, but call us individually to and we can look into that. So it's not a hard no. So I'm afraid I can't give you more of a concrete answer at this moment.
Thank you. Does the program affect respite hours from regional center?
That again is the same answer. So it could be, but it's not always the case. So we've seen it happen before, but most of the time it will affect respite hours through regional center.
And then who would we speak to about our child qualifying for these programs?
So you can contact me, or you can go through this referral process with this information and send in through this link. And then one of our intake people will contact you to do an assessment to see if you qualify.
Okay. The other question is, how do they apply? But I'm assuming it's that QR code that's on the screen.
The QR code or the link, the HTTP 24hrcares.com/refer.
So we'll send that out alongside with the presentations for those that are attending today, and it will also be on our Autism Youth Library. So you can go back and grab a snapshot of the QR code as well.
Sure, I'll send this slide presentation to Melissa, and so she can distribute it to people that would like to have it.
Will do. And how much the rate you pay for the workers?
So it's comparable to IHSS. So it's around $16 to $18 an hour. So we're not here to compete with IHSS. So we're the same rate as IHSS, depending on the county.
And then can families with Kaiser as their Medi-Cal MCO also access this service?
So Kaiser patients can access this service. However, it doesn't come through us. So we are not able to process those referrals. Kaiser has their own way that they want to process it, and it has to go through their Kaiser Connect portal. So that means that you would have to reach out to your Kaiser social worker, and request that they submit an application for you for the CalAIM personal care and respite program.
Okay, thank you. And do you know who determines the pay rate?
It's already predetermined, so we don't do it. I believe it comes from the plan.
Can children under the age of 3 also qualify for this service?
Yes. So regional center, I believe they have to be at least 3. Is that correct, Melissa?
For, yes, regional centers 3 and older, and then the early start is 0 to 3.
Okay, so we can do it before 3.
Thank you. And those were the questions I had. If anybody has any more questions, please feel free to add them in the Q&A or the chat. Let me check the other chat. No, we've answered all the questions.
Okay. Does anyone want to review any of the slides?
Let me see. If anybody wants to see a specific slide, please let me know. You can ask me in the chat or the Q&A and I can have her go to that particular slide.
So I think for the autism community, it's probably going to be mostly respite, right, Melissa?
I believe so, even though I do think it's case by case, just depending on some of our families have dual diagnosis, so it's not
I
only
see.
solely based on autism itself.
I see. Okay. All right. So you have my contact info. If you do want to reach out to me, I'm available to discuss with you your individual situation. And you know, you can send in that referral to us. That's fine as well. And then we'll reach out to you.
Okay, and I have got a few more questions. Someone would like to see the last slide, please.
The last slide, okay.
I think it's the one with the QR code.
Oh, okay, sure. The referral instructions.
I believe that's the one.
Yeah. Okay. This one.
I believe so.
Okay.
Let's see if they reply back. And then another question is, will the pay rate differ depending on the diagnosis of the individual?
No, it's the same.
And this is a two-part question. Does it only cover in-home services, or is it out of the house respite an option?
Only in the home.
Only in the home.
And just to emphasize, only in the home, and they must be able to identify a caregiver. So they have to have a caregiver in mind that would be willing to be employed by us and to provide that service.
Okay. And I do have a question that came in from one of our Spanish speakers. So if an IHSS recipient gets the hours cut and the caregiver is going to dispute the notice of action, can this service supplement those hours that were cut until they go to hearing?
Yes, so they're appealing for that, so they're getting reassessed. So we're waiting for an IHSS decision. So that's where we can come in.
Thank you for answering that. That's actually a really good question. I would have never thought of that. Let's see if anybody else has questions. Nope, we've covered them all so far. So if anybody has no more questions, oh, sorry, can the parent be the provider?
The parent can be the caregiver, yes. So let's say mom is a primary caregiver. Dad can be the chosen caregiver under CalAIM. So we're providing respite for mom, and then dad could be that substitute caregiver.
Can it be siblings, 18 and older, or is there a cutoff or starting?
So it has to be someone 18 and over and a legal resident, and that's it. So it could be a sibling. It could be a, you know, a friend, could be a neighbor, anyone that they think is appropriate for their family.
And how long is the authorization for? Is it an annual renewal?
So Yeah, that's a great question because this is a secondary resource, right? So IHSS is going to be your first line of defense. That's your primary resource. So we're here to bridge the gap or be a supplement to IHSS. I'm sorry, Melissa, what was the question?
How long is
All
the,
right.
do you have to renew
Okay.
every year?
So we're here on a short-term basis. So
Mhm.
the authorizations from the MCOs like from IHP would be 2 months at a time. And so, but if if the service is still required and IHSS hasn't made a decision, then we can renew that for every 2 months. So generally speaking, it's a 2-month auth to start with.
2 months, okay. And is it something that they come and do home visit, or is it over the phone or online?
There's never a home visit. So we never have to schedule a social worker to come into the home. It's all done on virtually by phone.
Sounds good. Thank you for answering all those questions. Let's see if we have any more. Um, yes, the recording will be shared, no matter what time you entered, and I will also be sharing the entire PowerPoint presentation. And if there are any questions, that weren't answered, if you think of them later, feel free to email. Her email will also be in the PowerPoint presentation. I got another question. What if we have IHSS and it's not waiting for a decision? It still has to be renewed every 2 months?
IHSS is generally renewed annually. So I'm not sure how your the situation is that renewing every 2 months. So at the beginning of the year, it's to my knowledge, IHSS schedules a social work to come to the home to assess the situation and to do a reassessment. But every 2 months that's something new to me, so I'm not sure what, as long as they're getting reassessed for something, we could potentially be supplemental to it.
But she's referring to like your program, not IHSS. So if they have a IHSS and they're not waiting for a decision, is it still every 2 months that
Oh, I
you'll
see.
be testing? Sorry, I
Oh, I
probably.
see. I see. So if they've capped out on the IHSS, let's say they're at 283
Mhm.
and we're providing care, then it's still a renewal of every 2 months. So by the time that the 2 months authorization is coming to an end, we will reach out again to say, we'll do another virtual assessment to see if the need is still there. So just keep in mind that this is a state program. It's funded by taxpayer money. So we want to make sure there isn't fraud, there isn't abuse, that people are not taking advantage of this program, because the state is responsible to spend our money, right? So they have to use it in a very productive way to get the care and the money to people that actually need it.
Thank you for that. We see. All right, we had great, wonderful questions. Thank you guys for participating and sharing your questions with the rest of us.
Yeah, definitely good questions.
We can wait 1 more minute. Let's see if anybody has any more to discuss. And Lynn, can you go to the page that has your contact information as well?
Yeah,
So
sure.
with the an individual that came in a little bit later.
Yep. This time I'm going to do it the fast way. Okay.
Do you want them to email Marissa moving forward, or?
You know what? They can email me for now, Ling at 24hrcares.com, because all the emails that are coming to me will be forwarded to Marissa.
Okay.
But they could do both. I mean, she's not answering her emails until next week. So I guess that's fine as well.
Okay, sounds good.
Okay. Yeah.
Okay. Well, if no one has any questions, we can end the evening short. And it was a pleasure having all you guys attend and join us this evening. We will send out this recording by the end of this week, so definitely check your inbox. If by any chance you do not see it, please feel free to reach out to the Autism Society so we can get that sent over your way. Thank you all for joining, and I hope you have a wonderful evening. And Lynn, thank you so much again for your time and your expertise on counting. We really appreciate you coming to speak this evening.
You're really welcome, and I really enjoy the questions. It seems like a very engaged audience today, so thank you for that. And yes, have a wonderful evening.
Thank you all.